Hi, I'm Dr. Bill Gradishar from Northwestern University, and I'm pleased to participate in this yerba video. One of the questions that's commonly asked is there something in my lifestyle or something I did that accounts for why I developed breast cancer? And, the simple answer is we don't know, and it's unlikely that there's any one cause that accounts for a diagnosis of breast cancer. And the exception to that, of course, is if somebody has a genetic propensity to develop breast cancer, which of course is not your fault, you have a heightened risk of developing the disease. But if you set that group of patients aside, which is about 10% or less, the vast majority of patients, probably 90%, there isn't a clear etiology. Nonetheless, patients often think of a variety of things that may account for why they might blame themselves for developing the disease. And among those things include, did I exercise enough? Did I eat the right things? Or was I eating bad things for a significant part of my life? Was I under undue stress? Was I drinking too much alcohol? So all of these things are factors that come to mind and have been evaluated in epidemiology studies to look at whether they influence the risk of developing breast cancer. But for the important critical thing is that for an individual patient, with the exception of genetic causes of breast cancer, we can't really state with any certainty what caused the breast cancer to develop. So in sporadic breast cancer, non-genetically influenced breast cancer, most patients don't have a clear etiology or cause. Now, with that said, it does bring up those issues that I just suggested. So alcohol as an example. We know that alcohol in large quantities is not good. However, I tell my patients, even with a diagnosis of breast cancer, they don't have to completely not drink any alcohol. The general rule is that if you do things in moderation, regardless of what it is, you're probably going to be okay. And that's generally with health in general, not just with breast cancer. Alcohol can cause an increase in weight. And this, of course, can also cause increased amount of estrogen that floats around in your body. And as a consequence, that in of itself can increase the risk of breast cancer. Again, for large populations of patients, not necessarily for an individual patient. We also know that alcohol can cause inflammation and other changes at a cellular level that could very well influence the development of a cancer. Now, that said, we don't know, and I want to emphasize that repetitively, that in any given patient, alcohol consumption can be directly linked to why a patient developed breast cancer. Let me give you another example. Patients who think that I didn't exercise enough. Well, you could probably say that about 90% of Americans. Most Americans don't exercise, and not everybody gets breast cancer. What's the influence of exercise? Well, it helps you in some ways burn calories, maintain your weight, or decrease your weight, or get it to a better level than if you're heavy. And what's the consequence of being heavier? You have more fatty tissue around. Fatty tissue can be converted into estrogen, which can also influence the development of breast cancer. Increased fatty tissue can also cause inflammation, and inflammatory changes at the cellular level can also cause an increased risk of breast cancer. But circling again back to the primary point I made at the outset, we don't know in an individual patient that any one of these things is the specific cause for why a patient developed breast cancer. Another thing that patients often complain about is their level of stress. And I think it's fair to say that most patients have some level of stress, whether it's related to their job, their family situation, relationships, whatever. Could this have been the etiology for developing a cancer, and specifically breast cancer? We don't know. Again, it seems like a repetitive theme. We don't know that stress caused the breast cancer. However, we can say with confidence, stress isn't a good thing. If you can minimize it, eliminate it, mitigate it, those are good things. They help you cope better. Certainly if you develop breast cancer, having less stress as you go through the process of treatment and recovery is a good thing. And stress also causes inflammation, and at a cellular level, it could be theorized that that causes an increased risk of developing a cancer. But we don't know that in an individual patient that stress accounts for the reason a given patient developed breast cancer. If you'd like to learn more, go to yerba.com for an individualized understanding of your situation, because every patient is different, and understand the treatment options that are available to you, what the pros and cons of each of those therapeutic interventions are, and hopefully this will add to your level of understanding of your disease. At yerba.com, you will also have the opportunity to ask medical experts about your situation, and they will give you personalized information that applies to your clinical situation, as well as treatment options and the pros and cons of all the therapies that may be offered. Another common theme is my diet all wrong? And I can't tell you how many patients, once diagnosed with breast cancer, veer completely off whatever diet they were on to something that either has no meat in it, they're completely vegan, they stay away from all sugar. And are these things going to change the course of their disease? It's not clear. I mean, there is some building evidence that in patients with cancer, not patients who haven't developed cancer, that doing some of these things, which can translate into an improved body weight, decrease the amount of fat, could have some beneficial effect. But again, coming back to the issue of a complete departure from what might be viewed as a normal diet and focusing on only being vegan or only eating things that you buy at an organic grocery store, are these things going to mitigate all risk for developing breast cancer? And there's no clear evidence that it does. So what I tell patients, and again, these are those that are diagnosed with breast cancer, is to eat a normal diet. Eat as normal, eat as many, have a mixture of colors and vegetables in your diet. And the goal is to have a nutritious diet that isn't excessive in the amount of red meat, which is good for your heart, good for your general health. More vegetable-based composition of your diet is always good, with fruits, nuts, etc. But suggesting that there is a specific diet that would have alleviated any risk of developing a cancer, or if you have a diagnosis of cancer, that sticking by a diet that, as an example, avoids all sugar, you cut out all red meat, is that going to somehow eliminate the risk of the disease showing up again? And the answer is no. I try to tell patients that they should enjoy life, and one of the key things that patients do enjoy, at least the vast majority, is eating. Not in excess, not with a focus on, a 5-pound hamburger every night, but trying to have a balanced diet with representation of fruits and vegetables. And I think if you do that, your general health will be improved, and potentially your risk of either developing breast cancer or minimizing the risk of the disease returning would be improved. Now, having said all that, one of the key things that patients want to understand is, what can I do? What can I do either if I'm a patient that's been diagnosed with breast cancer or one who is not yet a patient, but try to minimize their risk of developing breast cancer. And, part of this has to do with taking control of your own health, your own well-being. And certainly in patients with a diagnosis of breast cancer already established, oftentimes they're meeting with a variety of doctors on their team, and they're being told what they need to do, why they need to do it in terms of therapies. But those aren't things that patients necessarily control. Of course, they can decide whether they're going to accept the recommendation of their physicians, and hopefully they will, because that is going to treat their disease. But patients naturally, as any human being, they don't want to have that sense of having lost complete control of their destiny, in a sense. So having, somewhere they can point that they are actually doing something, whether it's in diet or whether it's in exercise or the amount of alcohol they drink, all of those things are modifiable lifestyle things that a patient has control over. And what I would say, and I think I tried to emphasize this, is though we can't say with certainty that manipulation of those things is necessarily going to change your risk, for sure, it does have a beneficial effect in terms of your overall health, not just related to breast cancer, but in general. So we applaud people who want to take those strategies and employ them, but just not to go to extremes, because you don't want to be tied to something for which there's no evidence and you're miserable about. So, balanced diet, do exercise you feel up to and gradually increase it. Try to minimize stress. Try to maintain as close as you can to an ideal body weight or work towards it. All of those things are positive and they give you some sense of control. So if we've been talking about the things that an individual patient can modify in terms of lifestyle and diet and alcohol consumption, etc., and although we don't have clear evidence that may influence your risk as an individual, the question often arises, what does cause breast cancer? And the simple answer, again, with the exception of those that have a genetic propensity, a specific gene abnormality that raises the risk of developing breast cancer significantly, is we don't know. There are a variety of things that have been associated with an elevated risk of developing breast cancer. Obviously, the most important one is being a woman, being female. And the other thing that also increases your risk is as you age. If you think of breast cancer, even though we often pay a lot of attention to younger women with breast cancer, the vast majority of breast cancer occurs in postmenopausal women. In other words, the risk goes up as you age. And what's the consequence of aging? More exposure over your lifetime to estrogen, which can increase your risk of breast cancer. As you age, there can be abnormalities as cells divide, and this can cause a mutation that leads to breast cancer. So all of these things, are potential contributors to a risk of developing breast cancer. And of course, teasing out what is the reason in an individual patient is one of the most common questions that I get asked, yet it's the one that we have the least satisfying answer for, because we can't pinpoint why an individual patient, with the exception of those with a genetic abnormality, actually developed the disease. The other important thing is that there are things that you can do, and these are, in a general sense, good for your overall health. Decreasing stress, if you can modify that, job or family issues or relationship issues, if you can minimize the stress, it helps you cope with the disease as well as the treatment that you're undergoing. And then, of course, there are a variety of other factors that you can also potentially modify in terms of the amount of alcohol, the composition of your diet. But again, patients have permission to do normal things. You can have a drink, you can have dessert, you can have a little sugar. It's not going to change the course of your disease. So I think understanding that you have permission to live a normal life as best you can, despite the challenges you have, is critically important to being able to cope with the disease, go through it, recover, and go on your way. So I look forward to talking to you again.